In the summer of 2014, we had the opportunity to sit and talk to dozens of physicians and clinicians individually about their practice of medicine. One of the questions we asked elicited some surprisingly similar responses, so we compiled them for you here. This is not meant to be a political statement, rather, it's simply meant to provide insight into the thoughts of some of those on the front lines of healthcare. The question was, if you were king for a day, or if you had a magic wand and could create one change, how would you change healthcare?
Do we have an hour or two or three?
I feel very strongly that everybody should have access to health care.
Everybody should be able to have access to health care.
I would like to see universal health care passed.
I'd like to be able to offer everyone the same quality of care.
I believe that every person, woman, man, child, everybody deserves a right to good health care.
The thing I would change would be to make sure that all patients have care, that the financial concerns are not part of healthcare decisions.
I'd like to offer a patient a treatment, whether it be medicine or a procedure or a test, and they simply can't afford it.
There's nothing that makes me more mad than someone telling me, like my patient did today, who's a senior and has COPD, that she can't afford her inhaler.
What I would want is that everybody could get the treatment that they need, regardless of their financial situation, regardless of their specific insurance plan.
That wish for me would be to have every family in America have the opportunity to have a family medicine physician.
I would wave my wand and make sure that patients had not only good access to care, but also had a good primary care physician that they knew they could go to, had a relationship with, and could start whatever process they needed to.
And I think it's frustrating when patients can't come and see me because their insurance has changed and we're not in their network anymore. So that's a bit frustrating. So it would be nice if we had a solution for that.
If I were king for a day, I would try to eliminate a lot of the barriers that are in place for medical care.
We have so many things that are pulling us in different directions. We need to get back to just taking care of the patient.
I would love to find a way to be able to balance our time more.
I wish we had more time, to talk about stuff, about whatever it is that made them, come in to see us.